Hello everybody. We've already spoken about care of the newborn baby's umbilicus in a previous video and I've provided the link below for those of you who haven't seen it. But in this video, we're going to be speaking about a simple do-it-yourself remedy for umbilical granuloma in a newborn baby. Following birth, the umbilical cord is clamped and cut as it's no longer required. The cord that is left behind eventually dries up and falls off, leaving behind the dry belly button. Sometimes, instead of completely drying, there's an overgrowth of tissue which looks like a soft pink or a red fleshy lump that stays on the umbilicus after the cord has fallen off and it really doesn't go away. This is called an umbilical granuloma and it's seen in the first few weeks of life. This umbilical granuloma is often wet or leaks small quantities of clear or yellow liquid, and it can prevent skin tissue from developing normally in the umbilicus. Now let's talk about certain general principles of umbilical care which would also prevent an umbilical granuloma from developing. You must keep the umbilicus clean and dry. You can wash well with soap and water while bathing your baby and then pat it dry. There's no need to use alcohol or povidone iodine, oil or ointments. You can keep the diaper folded below the cord so that the umbilicus is exposed to air and will dry up faster, and also to prevent urine and stools from soiling the umbilicus. Once your pediatrician identifies an umbilical granuloma, he or she might burn it off or cauterize it using some medicine on the umbilicus. But most often, they will just recommend treatment with common salt. So how do we apply salt onto the umbilical granuloma? You must do it only if it is recommended by your pediatrician. You can apply a small pinch of table salt or common salt onto the granuloma, and you can use an earbud like I've shown in this video. You can leave it on for about 10 to 30 minutes. If your baby is asleep, you don't need to cover it. But if he is awake and moving around, it is better that you cover it with a sterile gauze. Finally, you can clean the umbilicus with warm water. You can either wash it or use some wet cotton. You can also apply salt just before your baby's bath so that the salt will be cleaned out when you bathe him. Salt draws out water from the umbilical granuloma and causes it to shrink. This is very much like drawing water out of tomatoes while cooking them by adding salt. The umbilical cord doesn't contain nerves. Therefore, application of salt will not cause any burning or stinging. If the umbilical granuloma doesn't respond to salt treatment within a week or so, or if there are signs of infection like redness of surrounding skin, smelly discharge or pain, you must visit your baby's pediatrician immediately.